Okay, so if this is your first time to my channel, my name is Brian Monahan. I've been working with Medicare supplement plans for close to 20 years. And in my videos, I like to give you raw data and charts so that you can make a decision on what the best Medicare plan is for you because everyone's situation is different. So in my videos, I show charts like this and other charts like this and this so that you're able to make a decision. And in this video, I'm going to show you what you need to do if this is the first time you're going on Medicare, whether you're turning 65 or whether you're past the age of 65 and you're going on to Medicare Part A and B, or you're leaving your job. And then in later parts of the video, if you want to fast forward to them, if you're already on Medicare, I'm going to show you the top plans in Medicare, what the costs are, what they cover, and I'm going to do this through charts so that you can follow along and do math as to what you think is the best plan for you. All right, so let's start off with the first thing. Like I said, when you're turning 65 or when you're going on Medicare for the first time. So I'm not talking about Medicare Part A. Medicare actually really doesn't start until you're on Medicare Part B, whether you sign up for it or whether it's given to you when you are on early distribution of Social Security. But when you're signing up for Medicare A and B, the first thing that you need to do, as you see on the graph here, is call your local Social Security office or sign up online. I always say call the office because they will make a phone appointment with you and they'll walk you through how to sign up or whether you need to sign up or not. Now, there's many different situations. If you're working and a spouse is on your medical benefits through work and it's cheaper to stay on that plan, you might not want to get on Medicare Part B. You'll get Medicare Part A automatically, but your card might not say Part B unless you sign up. And then on top of that, if you're collecting Social Security early, maybe you don't want Part B, you'll want to deny your coverage when it comes in the mail. But your Social Security office can help you with that. So let's say you're going to sign up. So if you look at on the left-hand side here, you'll see sign up for Medicare Part A and B in yellow. Your next decision is going to be, do I want a Medicare Advantage plan or do I want a Medicare supplement, also known as a Medigap, MedSup, or Gap plan? Now that's basically 50% of your decision, believe it or not. It's that fast. A lot of people know I don't want a Medicare Advantage plan, so it's very easy to now decipher which Medigap plan that they want. But some people are confused between the two. So I'll go over a little bit about that in this video also. So if you choose a Medicare Advantage plan, you're finished. It comes with most of them, if they're a MAPD, which most people get, they're PPOs and HMOs, you'll get a drug plan with that. You'll get dental, vision, and hearing, and it will be one package. So after you choose your Medicare Advantage, you're done. But if you choose Medicare supplement plans or a Medigap plan, number one, you'll have to choose a plan. And those plans are lettered, like G, N, F. I'm sure you've heard of these plans. And if you look at the red in the chart, then you'll have to choose a drug plan. Most zip codes have about 30 different companies for them to choose from. And the way that you do that is you can go to Medicare.gov and you can look at, punch in your drugs and you can see it there. You can talk to somebody like us. And then you're also going to have to choose vision, dental, and hearing if you want it. A lot of people say I don't need it or I don't want to pay for it. And I'll go into what the costs are on my charts in the next screen. So that is basically, that will complete your packet. This chart right here, you're going to make those decisions. So let's move on and let me show you some of these plans. So if you look at the screen, I'm not going to go into this in too much depth because I don't do Medicare Advantage plans, only in one city, and I'm not going to get into it, but I have seen way too much, especially in the last couple years, where I don't like Medicare Advantage plans. Number one, there could be networks, and people say, well, I'm going to get a PPO. That means you can go outside of the network, but that doesn't mean the doctor has to accept your plan. So you can say, I'm on a PPO and I want to go here, and the doctor says, I don't accept it. You're going to have to pay me cash. That's one reason I don't like it. Number two, In the past couple years, I've seen where a lot of companies, and I'm not going to mention any exact names, but big companies, Fortune 500, or companies that are huge companies, are denying coverage. And I know it's 2025. We have seen, different things like the shooting in New York City and so forth because certain companies were not covering procedures. They were denying it. That's all Medicare Advantage. When it comes to Med Sups, anything that Medicare pays for, the Medicare Supplement Plan will pay its share for the rest of it. And it's different for multiple plans. But if you look on this chart, I have Medicare Advantage and then I have Plan G and Plan N. Plan G and the Plan N are the only two plans that I offer people, unless they have to get a Plan F because they were 65 before the age of 2020 and it's some sort of a situation. But I'm going to go to another chart because I'm leaving this Medicare Advantage behind because, like I said, I do not do Medicare Advantage. So here are the two plans that me and most of the people in my company only deal with, and that's Plan G and Plan N. Now, keep in mind, if when I go through this, you're going to say, you should, if I do a good job, you're going to be able to say, you know what, I like the Plan G better, or I like the Plan N better. Now, after you choose that plan in your mind, you'll say to yourself, you have to get a company. So let's say you choose Plan G. You say, that's the plan for me. Now you have to look at different prices from companies such as Aetna or Cigna or Humana or United Healthcare. Most of the time, there's about 20 different companies in your area. But once again, most brokers like myself narrow it down to the companies that they like and plus cost-wise. So it's not that complicated. But I'm going to go over Plan G and Plan N. And my job in this video is by the end of this video, you're going to be able to say, you know what, I want the G or I want the N. And then you'll talk to somebody like myself and they'll be able to go over different companies and different prices. All right, so let's start with the premium. Now, the first things first. In 2025, if you look on this chart, you see your red, white, and blue card. That's the card that Medicare itself sends to you. And that covers what they say is about 80% of your cost. You pay $185 for that card to pay for 80% each month. So everyone is going to pay that $185. There's some Medicare Advantage plans that will cover some of that. I don't like those plans. I think it's kind of, in my mind, just an opinion. It's almost like we'll give you this, but we're going to take over here. And I don't like it. So most people, if not everyone, and trust me, if you're not broke, you're not going to go on a Medicare Advantage plan that pays the Part B. So this is a Part B charge, and you're going to pay this $185 to the government, either every month, or if they'll take it right out of your Social Security check, or they'll bill you quarterly. But keep that in mind, $185 each month. Besides that, that's your 80%. Now let's cover your 20%. So you take a Plan G, and if you look at the chart here, for a 65-year-old, the average is $155 a month. Now I'm going to tell you what the Plan G is going to cover, but medical-wise, I can tell you this pretty simply. It's pretty much going to cover everything that your Medicare Red, White, and Blue card doesn't cover. So when I go through this chart, just keep in mind, Plan G, once you pay a small deductible, you can go have surgery, whatever it is, and they're going to pay for everything. So it's a great plan. But let me go through it. So the second column here is hospital. Now, if you see, hospital is at 0. So if you have a Plan G, you pay your $185 to the government. You pay $155 per month on average. If you're in New York City, it's going to be double that. Just keep in mind. But you're going to pay nothing when you go to the hospital. Stay overnight. You can stay there for up to 1 year, I think it is. And then it recalculates. But you're not going to pay anything for the hospital. So what are you going to pay for? Well, you're going to pay an outpatient deductible of $257 per year. It's not that much. So you can just tack that on to your yearly cost. And then you're done paying for hospital, doctors, and so forth. But let's move down. So what are you going to pay for the doctor and the specialists, for copay or deductible or anything? Well, we already talked about the deductible, but once you pay that $257, you're not going to pay a copay going to the doctor or specialist. And if you look all the way down, urgent care, you're not going to pay anything. ER visits, 0. CAT scans, 0. Chemotherapy visits, 0. Let me scroll down. Infusion treatments that you need, 0. Physical therapy, 0. Skilled nursing, you get up to 100 days at 0 cost. Now, in the Medicare Advantage plans, I'm going to say 99% of them because I don't know the exact amount, you only get 20 days of skilled nursing. So I'm telling you right now, I've seen a lot of strokes. I've seen a lot of things in my last 17 or 18 years working with Medicare. And you want 100 days, you don't want 20, because 20 goes quickly and then the costs start adding up. Over those years, I've figured out, I've had other people on Medicare Advantage plans, and all they have done is complained as soon as something like that happens. And of course, you want the best plan for the best price, and that's what G&N are going to give you. But let's look at the maximum out of pocket. So if you see there, it's $2,117. Now keep in mind, this is only medical. It's not drugs, and it's not dental, vision, and hearing, like I show on this chart. I'm just going over the first thing. But this, if we scroll down, what this is, and maybe I have to scroll over here. Yep. Go back up a little bit. So if you take your Plan G, $155 per month on average for a 65-year-old throughout the entire country. Multiply that by 12 months. You're going to pay $1,860 for the plan itself. Now, add in that $185, but everyone has to pay that. So I leave that out, and sometimes in the comments people say you didn't add the $185. Everyone add the $185 times 12 separately. $155 times 12, $1,860 is what you'll pay for the year. Add that $257 deductible, because most people are going to pay it unless you don't go to the doctors at all. And you get $2,117. That is the only thing you're going to pay for medical. As long as it's medically necessary, they're going to cover it. Now, like I said, I have thousands of clients in my industry, in my brokerage, and when you have a Plan G, I never get phone calls, they didn't cover this, or my doctor didn't accept it. If Medicare accepts it or Medicare pays for it, if the doctor or hospital accepts Medicare, which 99% do, and Medicare pays for the surgery or whatever it is, this Plan G, no matter what company it is, they have to pay for it. So that's going to be your out-of-pocket cost. Now let's scroll up and look at Plan N. Now the first thing that I can tell you about Plan N, in prior years, I even said this myself, so it's not, my title was, they lied or whatever it was. We were kind of sold a bill of goods. And when I say we, agents, brokers, owners of insurance companies, I was sold the same thing, that the Plan N, because we looked at the averages of the prior 5 years or whatever, before Plan N was really, really popular like it is now, 50% of my clients get Plan G, the other 50% get Plan N. It's almost 50-50. Before that, Plan N did not go up. The premium didn't go up as much as the Plan G, meaning percentage-wise. That is not true anymore. That, I can tell you right now, I've gotten enough emails, I've talked to enough clients where they've emailed me with the exact percentage. And we actually keep track in a CRM of what our clients, the percentage of what their costs have gone up each year. So I know, oh, well, look, this went up 8%, or this guy in the last 2 years, it's gone up 19%. Now with the Plan N, that has happened in the past year so many times I can't even, I don't even know how many times. It's a lot of times that it's gone up way over what people would say. It's gone up percentage-wise more than Plan G. So that is a myth, and you're going to hear it over and over and over again. I'm sorry, but it's wrong. And I have the proof. I should pull up emails on the screen, but I just don't have the time to do that. So Plan N, let's go over it. So keep in mind, do not, whichever one of these you like, do not fall for that. Plan N doesn't go up in price as fast as Plan G because it's BS, plain and simple. Now, as a 65-year-old, $130 per month. Once again, you're going to pay that $185 no matter what. But let's take a look. So what is the difference? Well, without even going over this chart, what I tell people over the phone, the difference is this. The premium's lower. You're going to pay that $257 a year for the deductible, but there's 3 differences with Plan N than Plan G. And let me scroll down. So as you see, hospital is 0. Same thing as Plan G. You're going to pay nothing. The outpatient deductible is also the same at $257 a year for 2025. Let's scroll down. Now with Plan G, you see doctor and specialist copay and is nothing, and all the way down are zeros. Plan N, you pay up to $20 to go see the doctor or specialist. It's not that much. Up to $20 is nothing. You're not going to pay $70. It's up to $20. It could be $10. It could be $15. It could be 0, which I've seen a lot. Urgent care or telehealth could be up to $20. Some people it's 0. Sometimes it's up to $20. That is the first difference, is you're going to pay a copay, possibly, going to the doctor or specialist. The next thing, if you look at the ER visits, Plan G is 0. Plan N is $50 when you go, unless you're admitted into the hospital, then it's free. Those are 2 differences, those 2 copays for mostly everyone. The third difference, now as we scroll down, let's pass that ER visits. As you can see, CAT scans, chemotherapy, infusion treatments, physical therapy, they're all 0. So just like the G, Plan N is all 0. A lot of people will say to me, well, I don't know about this Plan N because I don't want a $50,000 bill. Well, you're not going to get a $50,000. I have never seen it with Plan N. But one thing, also, skilled nursing, you get 100 days, just like Plan G, and that is huge. If you have anything, you could have knee surgery and have to go to skilled nursing, but something big like strokes or a heart condition where you had surgery, you had to go in, couldn't take care of yourself for a while, 100 days is a big deal. You don't want them to wheel you out to the street and say, I'm sorry, you're on a Medicare Advantage, you only have 20 days. No, both of these plans, you're going to have 100 days of skilled nursing. Now, there's a big thing that people will talk about. It's an excess charge. It's a Part B excess charge. And keep in mind, B is medical, like doctors, specialists, and so forth. But you could have an excess charge of up to 15% of what Medicare's allotted payment is. So if a Medicare, basically the 15% on top of what Medicare, their payment would be, the doctor says, I don't want to pay that much. I want more. They can charge up to 15% on top of it. But here's the catch. And I hope I'm explaining this correctly. It's less than 2% of the doctors in the country have an excess charge. It's like saying you have a 2% chance of living walking into a doctor's office. You're not in good shape. But the excess charge is so small. Out of every year that I've been doing this, I've never had a client, nor has any of my agents that work in my office had a client that's received an excess charge. I say this in my videos. I haven't seen it in the comments section. And I know a lot of people in this industry, big agents that have thousands and thousands of clients. And I've never heard about people getting an excess charge. Has it happened? I'm sure. But it's less than 2% of the doctors. And supposedly out of that 2%, 1% is psychiatrists because they don't get paid enough. But let's scroll down at the Plan N and look at the numbers. So I'll leave the Plan G up here also so that you can look at it. But Plan N, on average, 65 years old, $130 times 12 months is $1,560. As you can see from Plan G, it's about $300 less a month, approximately. But Plan G kind of ends, they have the deductible of $257. Then they end there. Plan N, you have that $257 deductible. Now you're at $1,817. But I put on here that you went to the doctor 6 times in 1 year. So that's once every 2 months you go to the doctor. A lot of people would do that. Now you're up to $1,937 if they charge you the maximum amount of $20. And I put 1 ER visit at $50. So now we're at $1,987. So let's scroll back up here again. And let's look at the total cost column. So I put maximum MOOP, that's maximum out of pocket per year. And for G, it's $2,117. For N, it's $1,987. I can tell you right now, 2025, what do I like more? Well, it depends on the cost, because you have to look at your zip code, your gender, and all these different things. But if the cost of the Plan N is not $40 less a month, I'm assuming most of my clients are going to get on a Plan G. Most of my existing clients will still switch to a Plan G, or new clients. But when you talk to me, I try not to make that decision for you. I mean, you know, my opinion, of course, I'll say, well, I think this. It really depends on the situation. But most people can do the numbers, and I'll give them the numbers and say, hey, here's your premium. And, you know, if let's say you went to the doctors this many times, you know, these are going to be your costs. And most people make the decision themselves. You know what? I like Plan N better. I want to go with that. Or I like Plan G. But the one thing this year I'm going to tell people is do not fall for that. Plan N doesn't go up as fast as Plan G, the premium, the increases, because it's just flat out not true, unfortunately. And I told a lot of my clients that, and I'm hoping, hey, that some of them, it didn't go up as much. But if it did, all they have to do is call me, and I'd look for another plan or another company, or I put them on a Plan G, and you know, we go from there. So it's not that big of a deal, but it kind of stings when you tell somebody, hey, this isn't going to go up as much, and then the next year, that's exactly what the companies do. They raise the price. Makes us look bad, but we're not the ones, you know, if you looked at the past, it's not like we're lying to people, but I'm not telling that to people anymore. So there you have it for this. Now, let's look at this chart again. Let's go back. So we went over Medicare Advantage, forget it. If that's the route that you want to take, or you're even thinking about it, then probably you didn't watch this video. If you go Medigap Plan, I went over G and N. Those are the only 2 plans I do. If you called me and said, well, I heard about this Plan K, I'd say, well, call somebody else. Because I have done it before, all the numbers and everything, and there's nothing, in my opinion, for all these years, and many other opinions, that G and N are the only plans you should be looking at. But if we look at the drug plan next, which a lot of you want to look at, keep in mind, look at this column. When we run your drug plan, I always send an email. I just click a button, an email goes out to you, and it says, you know, please send me a list of your drugs and the amount you take, like 1 a day at 50 milligrams or whatever it is. Then we run your drug plan. The drug plans usually there's a 0 premium plan, sometimes a couple dollars, $5, whatever it might be. And it goes all the way up to, it could be $100 a month. That's like a really extreme case. But I put on here, most people that are 65 that I talk to are paying between 0 and 10 month in premium. Now, if you're taking generics, your copays might be $1 when you go to whatever it may be, CVS, Walgreens, Costco, or mail order. So the drug plans can be significantly cheaper than what people think. So tack on $10 a month for your drug plan if you want to. If you don't take that many drugs, in order to not get a penalty, hopefully there's a 0 premium plan. We'll put you on that plan. And people say, well, what if I get on a major drug? Well, there's a deductible to the plan, but if the drug is covered, you know, which most of, you know, they'll cover the drug and you just pay the deductible. So we would talk about that once, you know, you actually chose a G or an N, which is the most important thing. Dental, vision, and hearing, it's usually around $40 or $50 a month, depending on, you know, it really depends on the company. Most companies have that. I don't really want to get into it. Some people need hearing aids. Some people need dental work done. Um, the, Basically, there's a lot of one-page flyers that will tell you, hey, we pay 50% of a crown and that sort of thing. So it's not that tough. Most of these Plan G and N, they do not come with those frills like gym membership, um, over-the-counter cards, and all that garbage. Those are for the Medicare Advantage plans to try to lure you in. And yes, agents like myself or brokers like myself make big bonuses off of Medicare Advantage plans. So why don't I sell them? Because I don't like to. I don't like, quite frankly, pain in the ass stuff, to put it bluntly. I like everything clean. I like people happy. I like them happy with their plan. I like them to say, hey, you sound like an honest guy. 2 years later, I like them to be like, you are an honest guy. That's what I like. It's not about these bonuses. Let that be the rookies that you talk to that are really pushing that. And I hear all the time, hey, you're the only one that didn't push a Medicare Advantage plan. Yeah, because I don't need the bonuses. That's why. Um, Leave that to the people that just started doing this or need the money for something. Anyhow, those are the two plans. Keep in mind, if you live in one of these states, with the Plan N, you will not have an excess charge. So Plan N might be a little bit more exciting for you. But these are the only two plans. Your personal, if you were to call, in the description, there's a link to make an appointment with me. If you click on that, it'll go and you can make an appointment and you can do your personal thing, because some people write in the comments, I live in New York and my Plan N is $260 a month. Yes, I said this is an average. So if you're 75 years old and you live in an expensive state like New York or possibly Chicago or something, it's going to cost you a lot more. So it depends on where you live, which is your zip code. Depends on if you're a male or female. Hats off to the females, you get to pay less, and some other factors. I hope this video helped. Thanks for watching. Please leave a comment, a thumbs up, subscribe to the channel, and I will see you at the next video.